Today we're going to take a dive into the field of implementation science, and we'll explore strategies that bridge the gap between research and practice. And we'll discuss primarily qualitative methods and how they can be used for uncovering the nuances of human behavior and organizational culture. Our overall kind of practical application of today is going to be focused on going through a step-by-step guide to qualitative coding, which is one of the key tools that we use in qualitative research for analyzing our data. And then we're going to look at an applied implementation science and mixed methods project that showcases a real-world example of this approach in action. And I'll end the discussion then today by opening the floor with some questions for everyone, and then as well as if anyone has any questions for me, I'm happy to answer them, and we'll make sure that we can discuss anything that anyone would like to. That said, though, if you have any questions throughout the presentation, please feel free to drop them in the chat. I'll make sure to try and get to them as we get going along. So just to dive right into implementation science. So implementation science explores the effective integration of research findings and evidence into healthcare policy and practice. And in particular, implementation science focuses on the how and the why of how healthcare innovations or interventions are adopted in real-world settings. Implementation science is inherently a multidisciplinary field, and what that means is that it leverages insights from health services research, from sociology, psychology, from anthropology, where a lot of qualitative methods originate from, and a variety of other fields. And it does this to try and understand barriers to evidence-based practices. So unlike traditional research, which is focused on trying to prove whether or not interventions work, kind of looking at the efficacy of something, implementation science seeks to ensure that interventions are effectively delivered under routine practice. And there's a couple key concepts and frameworks that overall will guide our discussion of implementation science. So the two key concepts are thinking about fidelity. Fidelity is the degree to which at least programs are implemented as they were intended to, and sustainability looks at the long-term output and ability of a program to be able to continue after the implementation phase. And there's some key frameworks that have come out and emerged in the literature as evidence-based frameworks for guiding implementation study designs and evaluations. And these include REAIM and CFIR. CFIR is the Consolidated Framework for Implementation Research. An additional framework was put out by the CDC several years ago is PRISE, which is promoting action on research implementation in health services. And there are many other different theoretical frameworks, and it's important to understand kind of that these will complement each other. So for example, REAIM is something that really aids in designing and developing the evaluation methods for an intervention, whereas CFIR is something that is more focused on looking at factors that are associated with successfully implementing an implementation. These are overall frameworks, though, that when used as intended, allow us to systematically plan and execute and evaluate healthcare interventions. And in particular, I'm going to focus on the Consolidated Framework for Implementation Research today. And this is actually a framework that was developed in 2009 and recently has undergone a little bit of a resurgence, transitioning from CFIR 1.0 to 2.0. And it has some overall general similarities between the two different models, although there were some new additions to that. So the Consolidated Framework for Implementation Research posits that there are 5 domains of factors, and each of these factors is associated with the success, or by extension, potentially the failure of implementing an intervention in a healthcare setting. And these different domains are innovation, which is what is the thing that is being implemented, and perhaps what are some of the perceptions about its properties. And innovation, the large domain is composited of several different subcomponents, as you can see here, that include things looking at, for example, the evidence-based, the relative advantage, adaptability, trialability. A lot of these components you may recognize if you're familiar with the diffusion of innovation theory, where some of them originate from as well. Other domains include the individualist domain, which is thinking about who are the individuals that are most likely to influence or have authority to influence an implementation, or who will deliver an innovation. The inner setting, which is where will the implementation occur, from where will the implementation be delivered. The outer setting, which is essentially the setting within which the inner setting exists. And it's important to often define where does the outer setting begin and the inner setting of an intervention end. And finally, the process, which is looking at to what extent do the different actions necessary for an implementation adhere to the way they were intended to be implemented in the beginning. So each of these different domains has several different components. And if you take this together, this is quite overwhelming in that there's a lot of information to process here. There's a lot of different things to consider clearly when we think about what are factors related to how well an implementation or how well an intervention might be implemented. However, I think what's important is that this is overall a framework. It's a guide for identifying factors. And in a lot of evaluations, you may not necessarily have the resources, the time, or the capability to look at every single one of these factors. But I think what is really nice is that using qualitative methods, in my experience, I've found a lot of the benefit of them is that we're able to identify what are some of the most important of these factors that are related to the success of implementing intervention. So I want to leave it there for a moment with implementation science and talk a little bit about qualitative methods now. And then we're going to come back to implementation science when we talk about the project that brings these two together. But are there any questions before I go on to the next section? I don't know, are there any in the chat?
I don't see any questions in the chat.
Okay. Excellent. Qualitative methods are a really useful tool in research for understanding and empowering a variety of different perspectives. So for example, we can use qualitative methods to try and shed light on patients' lived experiences, to uncover written rules that may guide provider behaviors and beliefs, that try to explain quantifiable changes in health outcomes or inform the next steps for a program. We can also identify systemic barriers and even potentially set policymaking priorities. And when qualitative methods are used effectively, they have been shown to empower communities, groups, and individuals. And there are more structured frameworks such as community-based participatory research that really incorporate a lot of the tenets of qualitative research in order to really go about using them as a method, not just for conducting research, but also for carrying out interventions that do empower communities and put them in the driver's seat for research. So qualitative methods that by amplifying the voices and agendas of those who share common experiences can be a really powerful tool when harnessed. And I think, and often this is when they are used in conjunction with other methods like quantitative things like surveys or other sources of data as well. Qualitative methods are a gateway to understanding the depth of the human experience, and they provide a really unique lens through which researchers can connect with individual narratives and the often unheard voices in our society. And there's a lot of different ways in which they can help to bridge research with actual experiences from the field. They offer rich insights by situating personal experiences within a wider context, giving us a deeper understanding, and they can help us to identify emerging patterns, forming bridges between raw data and established theories. And overall, this enriches the landscape of our research by giving us a more nuanced perspective and helping to guide our hypotheses. In terms of practical applications, in addition to the value of using qualitative methods for participants, that is, in terms of benefits that participants might get from them, there's also a variety of practical applications for public health and health services researchers. Qualitative methods can serve as a really powerful tool in a variety of fields, enabling us to delve into the intricacies of human behavior and social phenomena. They also can allow us to grasp the subtleties of complex situations and optimize the delivery of interventions by understanding contextual factors. And ultimately, this could shed light on how and why change occurs within organizations or communities. We also, therefore, can better appreciate the diverse perspectives of all those who are involved. Finally, qualitative methods are very adaptable, and they equip us, because of that adaptability, with the ability to monitor and respond to novel and unforeseen events. And this can ensure, at least, that we remain adaptive and insightful in a world where things are changing very rapidly. And this is of particular importance. Megan mentioned earlier that my own work is in social media research. And I find that social media, Twitter or X now, Instagram, there's quite a bit of data that's generated very rapidly in a small amount of time. And if we think about things like, the pandemic and how that may have brought a surge in social media use, was therefore also a surge in content. And if we can learn to analyze social media data, which is a really rich source of qualitative information, we can learn to analyze that in a rapid way. That can give us a really quick way to gain insight into how populations' behaviors and beliefs might be shifting. So that's quite a bit of lead up in terms of explaining what are some of the potential benefits of qualitative research, and we integrate it into implementation and evaluation science as well. And it's important, though, to think about this concretely in terms of what are actual tools that we have in our qualitative methods toolbox. And there are a variety of different methods, including ones that are focused more on individual approaches, such as key informant interviews, which are meant to be a bit more informal. If you're trying to gain information, you may consider this a technique similar to how a reporter might speak to someone on background and not on the record about something. And there are more structured techniques as well, such as cognitive interviews or semi-structured interviews, where the actual interaction would be audio recorded and transcribed so that you're not missing anything that the participant is saying there. There are other methods that are not individual, for example, focus groups that are essentially conducting multiple interviews at the same time with a single moderator. The only difference there is that you often will have individuals in focus groups kind of becoming the interviewer themselves, which can be a really nice interplay. And then there's other methods that don't necessarily involve using a tool like an interview guide or a focus group discussion guide to try and extract information from individuals, more that are much less unobtrusive. So observational research like ethnography or field observations. I'm right now working on a project that's going around VA clinics, VA dialysis clinics around the country. And we're using a really structured approach to collect information about barriers and facilitators to home dialysis that involves using a variety of different approaches that you see here. So for example, we're using interviews with patients and providers. We're also doing shadowing of patient provider visits. And then we're doing observations where we just sit at different parts of the hospital and the clinic and observe the overall workflow for a period of time. And for the most part, in my experience through qualitative research, most of the methods that we've used tend to be ones that are much more individual, focusing on speaking either one-on-one with people or in things using methods like surveys where you might get a lot of information from a very large number of people in a short amount of time. And you could use open-ended questions or closed-ended questions on those. The project I'm going to talk about later today used a interview individual technique called semi-structured interviewing, which we'll go through and actually look at an example next of what actually some of that data looks like. Looking at these tools, though, these different techniques, does anyone have any experience using any of these in their own work? I don't know if we can just do like a show of hands or something like that, if anyone.
Hi, Matthew. I've actually used GIS, so geospatial data. I previously worked with the Jackson Heart Study, and we were assessing neighborhood conditions through Google Street View. Yeah, so
Oh,
it was
that's
pretty helpful.
do you want to say a little bit more about that? You're using Street View, so where you were getting like imagery and then kind of going through and encoding the imagery?
Correct. So we had to give ratings to each neighborhood snippet that we looked
Mhm.
at. Um, and then I think they just rounded out that data to see how everyone rated each individual neighborhood to give it a
Mhm.
final score.
That's fascinating. That's an amazing approach and something that's really, a great integration of qualitative and quantitative methods with that. And just really resourceful as well in terms of finding a new source of data with that. And you could imagine how if you're kind of going in that, you may be able to even integrate other sources of data if you were to be able to like go to those areas that you were drilling down to on Google Maps and say do interviews or collect some kind of information from individuals on the ground there that you could even better merge into that data set there and make a very rich. But that's really interesting. I'd love to hear more about that. I've never done something quite that complex in terms of the using GIS. I've mostly used it for quantitative analyses myself. Um, any other experience?
You've got some experiences coming through in the chat, Matt.
Oh, um,
I could read them to you if that would be helpful.
I'm trying to see where my chat screen went. Sure, yeah.
So I said I've used interviews, free listing, focus groups, and field observations, and we've got someone else who's used key informant interviews,
Mhm.
key informant and cognitive interviews and focus groups. We've got someone who's coded videos of gestures and expressions, and then someone else with lots of experience semi-structured interviewing, focus groups, and field observations.
Oh, great. Oh, wow. And of course, right as you're saying that, I'm seeing where the screen, the chat window popped up on my screen. But thank you for that. That it sounds like we've got a really, a lot of different experiences here as well with some of these different methods. Some of which are very complex as well in terms of like thinking about the different um, kind of processes to go along with them. And from what I was hearing, actually, it sounds like there's some that are even more structured. So, for example, someone's saying that they done cognitive interviewing, also key informant interviewing, and just to kind of contrast these two approaches, I think that it's really great because key informant interviews are somewhat unstructured in that you often are letting the informant really guide the conversation, and you're trying to learn information from them that might inform writing something like an interview guide for more in-depth interviews down the road. Cognitive interviews is something coming out of kind of psychometric development where the actual questions themselves get vetted very, very intensely. So it's interesting to hear that we've got a lot of experience with that here.
And then you also have a question to explain the difference between focus, nominal, and Delphi group approaches.
Um, yes, that's great. So focus group is really a focus group discussion. It's something that happens live. Typically, you can do them virtually or in person. I think in person tech it might be better because you often will get the body language. Kind of people will see someone smile or something, and they can kind of warm up to that, and it gets the nonverbal communication going. But essentially, a focus group discussion, though, will use something very similar to an interview guide, where it's just a set of questions, and they'll be very open-ended, so that you can get discussion going. Nominal group and Delphi are more what you would call consensus-seeking techniques, where you're using the two of them to try and, of a large group of individuals, get to a single set of ideas. So. Um, Nominal group technique is something that typically can occur in like a meeting. And a good way to think about it could be that you've got individuals who are all meeting, maybe to determine grant funding priorities, and everyone would come together and put together a list of, say, 30 priorities, and then through discussion they would winnow them down and try and collapse them into similar groups and put them into a smaller list of say 10 priorities and then vote on them and rank them so that they can ultimately then be able to say they've got this like kind of weighted, synthesized list of priority across the entire group. Delphi group is similar to that, although it's iterative, or it's much more iterative in the sense that it's typically done through email or through actual postal mail, where people are being allowed the opportunity to write corrections to things. So for example, they may submit a list of priorities. They could get back the list of everyone's priorities. They get the opportunity to go through and do some editing to them and adding to them as well. And then they send it back. And so it really focuses a lot more on the wording. Although Delphi group and nominal group are very structured approaches, and that they've got like a kind of delineated series of steps with them. And I would have to refer you to more specific guide for those, because when I've done them, I've done nominal group virtually, and it tends to work pretty well. Delphi group, I've only been on the analysis side. I've never actually conducted one because I know that there's a bit more involved with that. What was that? Oh, did that answer? Was that Athena?
Yes, you got a thank you in the chat, so
Excellent.
I think you're good.
Great. Oh no, I'm sorry. Okay. Wonderful. So based on just hearing a lot of those responses, it sounds like there's a lot of diversity of experience here. And so what I'll show you next won't come as something that's too foreign, at least, but this is just an actual piece of qualitative data. We talk about qualitative research, qualitative methods, focus groups, interviews, but what's the actual data itself look like? This is just an example of a piece of qualitative data for anyone who's not familiar with what that might be. Qualitative data is anything that you could really analyze. It could be something like a Google map picture that I think Deja was talking about earlier. It could be an Instagram post. My dissertation, I analyzed thousands of Instagram posts about vaping that were geotagged, and I coded them, and then I matched them with quantitative data and GIS data. This, though, is just a passage from an interview transcript. And this is, I chose this because it focuses on implementation. I think it's actually quite an interesting quote, so I'll read it. So the interviewer asks, do you feel the Project X intervention has largely implemented according to plan? The respondent says, I think it's pretty close with a few of the clinics. There's 2 clinics that I think one was getting their team pretty close to up to speed, but hasn't necessarily really started. One wasn't there at all, and the others are doing pretty well. Again, I don't really have the data. Yeah, I kind of felt like I don't want to leave this yet. That was my feeling, right? They needed some more help, but hopefully they'll continue on the model and continue to use the processes. So there's quite a bit in terms of what we could unpack there and potentially analyze. But I think that just a passage like that is something that really can shed light on how you can use qualitative methods to gain insight into, as I was saying earlier, what are those important factors related to the success of an implementation. And so in looking at this quote here, there may be some different factors that jump out to anyone. Is there any particular thing here that you would say is like, what is a factor that comes out of this passage here? Well, I know it's qualitative research is something very iterative. So, I see someone jump in. Okay, so Casey said differences between study implementation sites. Both sites were not exactly the same. Okay, so there's variation. And then Athena said uncertainty, curiosity, and commitment. Those are all great. There's a lot of different factors, at least, that are kind of coming out of this just one little passage here. So there's potentially variability between sites, which, in hearing that, maybe it sounds like there was an issue in terms of fidelity, that one site maybe wasn't implementing it to the degree it was intended to. There also could be potentially this idea of kind of the commitment to it, which could raise a level of how engaged are the people who are implementing project X, this intervention here. And this is just one quote that's taken, so there's really no context that you've got to look at this to provide. But in terms of looking at this, you can kind of get this sense where we can extract quite a bit of information for implementation evaluation using something like an interview. So to recap, some of the some of the hallmarks of qualitative data are that it's a process that's very collaborative and it's systematic and iterative. And what that means is that collaborative in that you're in methods like Delphi or nominal group or semi-structured interviews or focus groups, you're interfacing directly with participants. And because of that, there's a much more human element to your data collection and to what you might actually learn from them because you're working directly with them. And so in that sense, even though they're participants, they are technically collaborating with you in what you're trying to learn there. It's a process that's very systematic, meaning that there's a lot of delineated processes laid out. So nominal group, Delphi, cognitive interviewing, there's very clear steps that you need to follow if you were, say, wanting to publish on that in the academic literature. At the same time, though, even though there's a lot of steps, there's this sense of iteration and adaptability in that you're allowed to go back and try things over and change your plan and be very flexible and reflective if it calls for it. And in terms of analyzing qualitative data, there are a variety of different analyses and analytic methods that have arisen. And some of the different theories that you may have heard or come across in your own work, if you're experienced with this, include grounded theory, which is a theory for developing a theory of a certain phenomenon. And in most senses, a lot of the work that we do in the Mixed Methods Research Lab is that we use what we call modified grounded theory or grounded theory approach, where we aren't seeking necessarily to develop a theory of a behavior from the ground up, as it might sound. It's often more trying to understand variations in themes or patterns within a data. And we may also be approaching it in a very directed, considered approach. And by that, what I mean is that oftentimes when we're analyzing qualitative data, we're approaching it from the sense of not just what is there that's going to emerge from this that that you may not have been aware of before, but you also come into it with some potential questions or hypotheses that you have beforehand that could inform what are called a priori codes. And usually most analyses are therefore this type that include, you're trying to answer questions through your code book that will tie both to your study objective, but also to what you're learning as you read through the data. So with that said, I'd like to then go into discussing a little bit of coding. And for those of you who have gone through and done qualitative analysis, this will seem then a little bit more like a review. And so please feel free to jump in if you have any questions or any kind of like tips from your own experience with this. So to go through and discuss what coding is, I think it'll be a good demonstration of overall how we can tease apart the important findings from qualitative data. So what exactly is a code? What does it mean to go through and to code data? A code on the kind of conceptual level is just a bucket. It's a category, it's a group. It's something that you take and you can drop qualitative data in if you think it's appropriate. So we could take that quote we had earlier and we could decide that this bucket is about uncertainty or curiosity or commitment. And we could code this entire comment as relating to that. And on the actual practical side, if you were to go through and actually code something using coding software, typically it's something like highlighting data and dragging it, dropping it into a bucket or a folder. And when you go through qualitative data, often we will be looking at something and we won't just see a single item. They're not necessarily mutually exclusive. We'll typically go through and be reviewing data and be coding for multiple things at once. And so I think that, the best name for a code is something that's very understandable, that's self-evident, that overall kind of like represents what it says, and you wouldn't need too complex of a definition for it. And so things like family, access, and food, I think, are names for codes that would be very easy to communicate to someone else and to allow members on the study team to apply uniformly. And when we're categorizing qualitative data, often we want to go through and identify what are the potential range of codes. And in a given project, you may typically identify up to 20, 25 potential different codes that you might want to use across an entire project. And oftentimes these will really correspond a lot with what your questions are that you were asking during your data collection. So in your interviews or in your focus group, if you ask 20 questions, you might not be too surprised then to find that when you go to code your data, you've got a lot of potential ways to code your data and a lot of themes, or potentially more than 20 even, that might emerge from that. I think is my general rule of thumb when it comes to coding qualitative data, though, a code book should in general have about no more than 20 codes or so. I think just because it can, in terms of like cognitive burden, when you're going and analyzing data, it can often be difficult to try and juggle a lot of different concepts at once. And by having it kind of limited to a certain set, I find that that can often be a way to make sure that you're not trying to over or code data, or rather, you're not trying to code data in such a complex way that it might make it difficult to actually code things that you have there, and you may miss things by extension. But you can always go back and take a second look at qualitative data. I think what's great about it, like any other data source, is that you can conduct secondary data analyses down the road. It doesn't necessarily have to be immediately when you collected the data. And this could include going back and looking at, say, you could have coded some certain large number of passages under a code of, say, family, and you could decide that you want to tease that apart and see what are some of the different subcategories related to family. And you could tease this apart and identify potentially there could be some different aspects related to family dynamics, to a partner or spouse, or to children. What's also great about going through and coding data is that you're able to identify cross-cutting patterns or themes across your codes. And so of a given code book, if some of the different codes present were family, friends, church members, or teammates, we may potentially look at this and say that this is a theme that represents something like social support. Oh, sorry, is there a question here? Oh, no. Any questions?
So no questions. I added a comment that for those folks that are doing work that isn't yet focused on implementation, so sort of relevant to your concept about you don't have to, you can go back and analyze things later, right? That people could add in concepts related to implementation to their qual work, whether it's field work or interviews or focus groups, and then kind of come back and analyze it later.
Absolutely. Yeah. Yeah, you can, I've been working on a couple projects right now. One, for example, is something that I've been at Penn as a faculty member for 2 years. I'm working with J.A. Sola at Chia, who you'd mentioned, Megan, on a project. We collected data in, I think, 2016, and we keep finding ways to go back and look at it. And there's narratives from Penn employees and students about experiences of inclusion or diversity or lack thereof. And it's just like we keep going back to it because we keep finding ways to kind of reanalyze it, to recomb through it. So you can absolutely collect data and analyze it later, you know, or even you may develop questions later that you might want to look at it again. So for developing codes, you know, these, as I mentioned, codes will often kind of come from couple different places. You may be going through and reviewing qualitative data, and typically on a project, my first step for trying to analyze something qualitatively is to go through and conduct this process called open coding or broad coding. And as you can see here, what it is essentially is just going through and reading transcripts and taking notes on them that are free text. And so you can see here that Rosie made a couple comments here about things like team handoffs and warm meetings. And what some of these notes here could eventually do is they could inform your development for an actual code book. Then they could synthesize these together. Another example. And through this very iterative process, which some of you have, yes, yeah. Well, I will say this is doing the open coding in Word. I find open coding, you know, it basically just note taking. It can't really go too much further than that, just because it's difficult to like use the same thing over and over again for doing the open coding in Word. But I do find Microsoft Word to be a really great way to go through and to do some of this work. I also like to just print off transcripts and take notes in the columns on them or in the margins, because it can, again, be a nice way to really familiarize yourself with data so that you can help to identify some of these codes that you might use. And in reading through transcripts, doing this open coding process, the ultimate goal is that you can take these notes that you'll see in the margins here, these comments, and in discussing them with your teammates, you can then go back and create a list of basically all of the different things that you saw in a transcript or in a set of transcripts. And that list of things that you saw in them, those themes, those are the basis for your code book. And I see there's also a comment here. Yes, yeah, you can also do code. The comment is that Laura Ellen has also seen coding in Excel, which yes, you can also do as well in that. You can do coding in a variety of different software. I mean, Word or Excel, you can do it in there. You've also, and I didn't want to introduce necessarily the software NVivo today, but NVivo is another one that you can use for this to go through and do the open coding process or the more systematic coding. So in going through and reviewing transcripts, reviewing qualitative data, ultimately the goal is that you'll take that and you'll create a systematic tool, something that then you can go through and look at all of your data using the same definitions, and you can review it. And so this is just a shell example here of a code book that includes different columns for the name of a code, the definition for when to use it, when not to use it, if there are any examples, and potential subcodes. And here's an example of one that's a little bit more filled out. And code books they're a dictionary. They're a data dictionary for your qualitative data. They are a way that you essentially can define these somewhat more abstract concepts and say, this is what I think, I mean, when I say incarceration, and this is an example from what someone said in the text. And the code book is, if you're maintaining it throughout a project, I think is a really just great way to one, organize your data, but ultimately to disseminate some of the findings from what you're looking at. And I think code books are another one of these things that, much like the interview transcripts, I'll print out a code book and kind of keep a copy of it with me so that I can take notes on it in the margins as needed. And this is an example of a codebook. This one was fitted for or formatted for publication, so you can see it's a little bit tighter in terms of the formatting for it, and there's no examples included with this. But it's pretty typical with qualitative papers to be including this as an appendix item or as a methods table as a way to kind of substantiate the rigor of your study, to show that you did go through this process of defining these themes and coding them. So before I go to that next part, kind of bringing back a little bit into implementation science, are there any questions or any thoughts on codebook development? Or has anyone got any kind of lessons that they've learned in their own experience with this?
So Matt, one question I have for you is increasingly I'll see people in implementation science talk about using a combination of inductive and deductive coding. They start off with a framework like CIFAR or something else, and that's sort of the basis for coding, but they also want to elaborate concepts that are grounded in the data. So I don't know if you've seen that before, but if you have thoughts about kind of how to operationalize that, that would be helpful.
Very much so. Yeah, actually, the example I talked about is exactly one like that we did. And maybe that's a good way we can go into looking at CFIR then next. So yeah, and coming back to CFIR then, what we can do is actually, in looking at all of these different factors here, as I said, there's quite a lot of different factors, and there are more factors in the 2.0 model than the 1.0. That's what you're familiar with, but overall, they're very similar concepts with them. But what can be really great is trying to understand different kind of flavors or variations of these different factors, as Megan was just talking about, by looking at things that are more emergent from our data. And so what the inductive deductive means is that you're kind of using a process where you're starting with something like this and then drilling down, basically to try and identify what could potential subcodes be from these. And they could be either from the data or from potentially like other studies, as I've seen. And an inductive deductive process is actually very similar to what I was talking about earlier, using the combination of a priori and emergent codes, where you're trying to kind of balance, addressing the questions that you had and, within the framework that you were being guided by, but also allowing the data to speak for itself to a certain extent. So in the project I'm going to talk about next, what we did was we took CFIR, we took the framework, and we tried to evaluate in implementation using semi-structured interviews. And then we used a method called qualitative comparative analysis to try and identify quantitatively which of those factors were associated with implementation. And I'll say that a couple more times just because I know it can be a little bit of a tying this all together, but I think it'll really help to shed light on a few of the things that Megan, you've been talking about. So this project, that MindEye project, stands for the Maternal Infant Diet Implementation, and this is a multi-site trial that was national on the West Coast primarily, and the Pacific Northwest. And the overall goal of the MindEye study, the analysis I'm presenting today, was to identify factors that were associated with successfully implementing a collaborative care model for perinatal depression. And this was implemented in sites that were providing maternity and pediatric care to historically underserved populations throughout the Pacific Northwest communities in Oregon and Washington. So we were ultimately, as I was saying, trying to identify what are those factors associated with the successful implementation. And so in order to answer that, then we used a couple different methods in our evaluation of this implementation. And these included semi-structured interviews, which we then conducted thematic coding on, creating a codebook. And then we used qualitative comparative analysis, which was a technique that really integrates the qualitative and quantitative research methods and a mixed approach. And ultimately, using these different methods, what we learned then through our study was that leadership, staffing, and available resources at the clinics were all associated with successfully implementing the collaborative care model, which we defined as sites that achieved competency had successfully implemented it. We also learned that patient volume was really crucial in terms of achieving competency and implementing the collaborative care model successfully, meaning that you had to have enough people coming through the clinic in order for the sites to get enough experience with that and gain the competency in the model. And so these were different things that we learned then in looking through the different findings of our study. So to be a little more specific, so the overall mind-eye study was implemented at 20 sites, and we conducted semi-structured interviews with site care managers, practice coaches, psychiatric consultants, and project leaders within the practice. And we conducted interviews pre, mid, and post-implementation of the study so that we could essentially identify which factors were related with implementing this intervention. Through our interviews, we identified a variety of different factors, and the large codes here, leadership, resources, and goal setting, are all derived from CFEAR. Leadership is within the individuals, resources is in the inner setting, and goal setting is part of process. And we defined each of these codes, and then what we did to facilitate our analysis was that we developed the code book and stratified codes on this valence, meaning that we stratified responses by assigning them high and low valences. So if respondents couldn't identify clear goals at a site, for example, we categorized their responses as low and vice versa. And what this stratification of responses allowed us to do was to place values on certain types of responses, which was then crucial for the mixed methods component of our evaluation using qualitative comparative analysis. So aside from setting up, though, all of that kind of like, and I'll show you in the next slide how we assign numbers to these, aside from how this allowed us to do a more complex mixed methods analysis, I think it's just very practical. It's a nice way to demonstrate the different pieces of CFEAR here, how you can really tie it directly from the model into pieces from drawing out pieces from semi-structured interviews. And before I go to the next slide, I will say that, and then the next slide actually will show it, leadership is a much larger domain. And so Megan, this is one where we actually started with leadership, which was from CFEAR, and then we broke it down into a variety of different pieces, including involvement, engagement, attendance, social capital, and a variety of other factors that were pieces that ultimately made up this composite variable of leadership. So
That's really helpful.
now this is where it kind of gets a little bit more into like the weeds here. And you can, please feel free to stop me. And I should have asked, I don't know if anyone has had experience with qualitative comparative analysis, but so I'm going to break down how we figured out what works best for the implementation in this setting. So we used a method called qualitative comparative analysis, or QCA for short, and it's a lot like detective work in that we're looking for clues in the form of these factors or conditions that are crucial or work well together to create an ultimate positive outcome. So ultimately the outcome is, in our sense, implementation success. So thinking of it as, piecing together a puzzle where some of the pieces are absolutely necessary and some are just really helpful to complete the picture. CFEAR, or not CFEAR, sorry, QCA has been around since the late 80s, and it's been used in a variety of different settings to kind of piece together these different puzzles. And so, for example, it's been used to help understand, why people seek help after getting trauma, or why some people choose to enroll in clinical trials. And currently, it's emerging as a really great way for checking how well implementation strategies are working, especially when we mix and match it with different research methods. So to do QCA, to conduct it, we first will create a table that scores quotes from different sites using the rubric shown here. So on the right side, you can see a scoring scale. And what we do is we went through and after going through and coding transcripts for the different codes shown on the left, the leadership with the different buckets, we then extracted quotes that were for each of those. So for example, quotes that were about leadership involvement, quotes that were about the care manager's staffing. And then we scored those quotes across our team. And multiple people scored them, and we then compared our scoring to make sure that there was reliable, that we were reliably scoring the same way and that was consistent. And ultimately, what that then allowed us to do then was to kind of go from taking quotes to these scores to being able to say, a site's leadership value score or staffing value. And after that, what we did was then plug it into our software, which did its fancy work conducting the quantitative side of this. And it ultimately then was able to tell us kind of which factors were necessary, sufficient, or neither. So there are some great visuals that come out of QCA that I think are really one of the great powers of it. And when we think about implementation, ultimately, implementation is rarely like a binary. It's success or failure. There's a million shades of gray there. But what this can help us to do, though, is identify success factors. So, for example, QCA will help us to take these different components here and identify combinations of different conditions that lead ultimately to success. And sometimes it's a little easier to interpret what these conditions are. So these are different paths here. And four paths, oh, sorry, I mislabeled it. 4 paths. And you can see the main domains across the top. Black dots represent that the condition was present. If it's a circle with a line through it, absent. And if there's just an empty circle, it means that essentially the condition was not present. It didn't matter if it was present or absent, essentially. It was like a moot variable. There's no correlation there. And so, interestingly, you might look at this and say, hey, that what says path 4, but it's the 3rd row there, there's actually no conditions there that are present. And so it can be a little bit tough sometimes to interpret these like that, but otherwise we can look at the other paths where we've got a combination of factors that are present and absent, and we can draw some interesting conclusions. So if we imagine that we're detectives trying to crack the data code of what makes a site really work and makes it good at what it does, our investigation here as detectives ultimately revealed that having the right people on board is essential. So that's leadership and staffing. But it's not necessarily just about who's there, but it's also about the tools and the know-how. So we found ultimately there were these 4 main recipes for success, if you want to think about it, one of which includes none of the factors. But we found these 4 recipes for success, and they all share common ingredients, resources, and experience, for example. But what I think is really interesting here is that setting specific goals or having your top brass or leadership deeply involved wasn't a must-have. So each one of these paths here has its own unique mix, which shows us ultimately that there may be multiple ways to potentially successfully implement this intervention. So this is one kind of really interesting visual that can come out of this work. And I think that visuals, when it comes to trying to present mixed methods work, visuals can be a really powerful way to do that. And especially in something like this, where there was so much work that went into ultimately getting to these findings. I'll show you one other figure, and then I'll make sure that we can get to discussion. So this is another figure that can come out of this, and this is just showing distribution of those different sufficient necessary pathways. And so the numbers within these colored cells here are the number of sites that was present, essentially. And so you can see from the overlap of these 5 large domains here, there's some different combinations within them. But ultimately, the ones where you've got the success factors, the green ones, there was very limited, just 3 sites. Are there any questions about Mind-Eye Project and any of these visuals?
So I appreciate your walking us through it. QCA I've used before. It's really, really complicated. But one of the things that you have to do is make judgment calls about how to compartmentalize the data. And so I'm curious if you can talk through some of the thought process about how do you come to a consensus as a team around categorizing the data in a particular way? Because that's sort of a necessary step in getting to a QCA analysis.
Absolutely, yeah. I'm just going to go back a couple of slides here to this. So I guess the short answer is how do you get to consensus on these? Is it takes a lot of time and group discussion. For this project, there's multiple, I think 4 people independently. Everyone coded the exact same quotes and scored them, and so we ultimately arrived at consensus on them after we had these descriptions, was by going through every single one where there was discrepancies with them and discussing it individually there, so that we could ultimately then decide which buckets these fell in. And through some of these, actually not through a lot of those, was where we filled in some of these more details about the scoring scale on the right here. And I did abridge this a little bit just so it could fit. But for some of these, for example, for goal setting, we had really explicit criteria in terms of like if they, had mentioned things like keywords like agenda, or like they'd like even had a single goal, or someone had like referenced wanting to talk about that. And so we had to kind of really refine a lot of these definitions, because it's easy sometimes to come to agreement about a definition of a code, but when you've got to come to agreement about definitions of valences of a code, it just means it's so much more. So ultimately, I think that's the biggest thing, is it does mean it makes it a lot more time intensive, because you do have to really discuss every one of the differences.
That makes sense. I will say, for folks that are interested in QCA, there are courses for it. It's in a family of methods called configurational comparative methods. Another one that's being used more in implementation science is coincidence analysis. So there are kind of week-long courses for both of these, because it does take a fair bit of philosophical understanding, and then understanding how to do the computational modeling to get it done.
Absolutely. And this is something where it was very intentional in the design of the study evaluation itself, that this method was ultimately going to be used with it. So it wasn't necessarily like all of this was done and then it was like, oh, wait, we should use QCA. I should be clear that this is something that like it was a 5-year study, and like the interview guides were kind of designed thinking that they would ultimately be able to use QCA to model that. And it's not always the best fit for methods. I've worked on another project before with QCA where ultimately it actually really didn't find much of anything in terms of sufficient or necessary conditions.
That's a good point. Yeah, it's an interesting tool, but I think you have to be willing to let it go if it's not actually helping you.
Mhm. And I see here, by the way, just in the chat, Laura, thank you for sharing that. Yeah, the CFIR guide, it's a really great resource, especially because there's, as I said, the CFIR 2.0 is more recent, and so there's just a lot less information out there about it. So, excuse me. So I do want to get some time for discussion questions, and I've got some discussions as well. But just wanted to, and then kind of think in terms of, looking back, looking forward, in terms of, ultimately, what is a lot of the kind of potential like challenges and the opportunities within the field of implementation science, and when we think about how we can use qualitative methods for that, I think often is that um, when we're looking at implementing something, it can often be very different to do that, especially if it's something new, just because you know not necessarily like the status quo is the best, but there can just be oftentimes hesitation. So because of that, evaluating the implementation of something itself can be severely limited. So there's, I think, been a lot more growing comfort in terms of like the just like necessity of evaluating your implementations. Not that it's like an audit necessarily. It's coming in to find the strengths and weaknesses so that you can improve them. I think, again, one of the great benefits of engaging in qualitative methods is that it's a way to really solicit feedback from your stakeholders and to learn who they are, and to learn about how you can ultimately then adapt your intervention to achieve the maximum fidelity for implementing it. So I do have some questions. Hopefully we could just think about in terms of your own work, how we could try and potentially guide our own next steps, and for thinking about the workshop series as well as just your own work that you're engaged in now. And so, yeah, I'd love to hear, about any projects that anyone's been working on, evaluating or are planning to.
So another thing that we'd love to hear about is, for those of you that are using qualitative methods in your work, and I know a lot of you are, how are you thinking about that unfolding, at least at the beginning of your projects?
One of the things that I've been thinking a lot about is asking the implementation research team themselves how the process is going, and engaging in some of that critical thinking and checking in. And so I'm interested to hear, what experiences you've had with that. I've done ethnography in the past, and you write up your observations, and then you have your journal, which, I think can capture some of that. I also recognize, especially when it's a big lift implementation, which often they are, that it can be asking a lot for people to sit and write or do some reflections in journals. And so wondering what your experiences have been with that.
Yeah, it's a great question. I think, yeah, things and writing journals or more structured feedback, often it can be kind of time consuming, and also like people may be hesitant for a lot of that. I actually think that um, you know one of the best ways that I do it within my own team is by trying to have, when possible, like weekly or bi-weekly meetings, so that we can talk about the actual issues that they may be potentially encountering, and get the feedback directly from them, so that they may not necessarily feel like if it's something that they don't want to put into writing or they don't, have the time to write about, that they could, then have the opportunity to debrief it with it then. So definitely have that like structured time to get the feedback from them, would be one. I think, another way, I guess, is that you, well, I guess it is that you could, have like opportunities for, maybe like using like some kind of like quick feedback survey, like a red cap survey or something of them, like that you could have a free text response box that they could, potentially fill in information that way. Couldn't take too long. But then again, I think that, yeah, sometimes you do that, it could even still go more in the way of like something like a journal where they may feel like they wouldn't have the time to actually provide the feedback.
I like the idea of a red cap survey. One of the things that I've done when I've had people do observations is structure reflection questions after they observed,
Mhm,
so that that's part of the data collection episode, is that reflection
mhm,
piece. And so we've been able to capture interesting sort of impressions when we've
mhm.
done that before.